Okay, let's break down a procedure that is so common and so fundamental in healthcare: nasogastric tube insertion. Now, it might seem pretty straightforward, but trust me, getting this right is absolutely critical for your patient's safety and comfort. So let's dive into the details of how it's done correctly.
And this image right here, this perfectly illustrates our goal. We're guiding a small, flexible tube from the nose, down the back of the throat, past the airway, down the esophagus, and safely into the stomach. Our whole focus today is making sure that journey is a successful one every single time.
So, before we jump into the how, we've got to get a really solid handle on the what and the why. Understanding the purpose behind the procedure is really the first step to doing it right.
The name itself literally tells you the path it takes. Naso for the nose and gastric for the stomach. It's a really simple concept, but think of this tube as a kind of gateway that lets us either put things into the stomach or, just as importantly, take things out.
You know, an NG tube is incredibly versatile. It is definitely not a one-trick pony. We might use it to decompress a really bloated and uncomfortable stomach, say after a big surgery. Or, on the complete flip side, we could use that same tube to provide life-sustaining nutrition directly to the gut. It's both a tool for healing and a tool for feeding.
Look, with any procedure, there are gonna be risks, right? But the most crucial point here is that these risks, they are almost entirely preventable if you just followed the correct technique. The single biggest danger, the one we all worry about, is placing that tube into the airway instead of the stomach. And that is exactly why the confirmation steps we're going to cover are absolutely non-negotiable.
Okay, let's talk about preparation. And honestly, this is arguably the most important phase of the entire process. Getting this part right sets the stage for a smooth, safe, and successful insertion. This is where you prevent problems before they can even think about starting. So before you even think about touching any supplies, you assess. You ask yourself, why does this specific patient need the tube? Have they had one before? Were there any issues? Do they have any allergies to latex or even the tape we're going to use? And maybe most importantly, what's their baseline respiratory status? This information is your roadmap for a safe procedure.
All right, once you've done your assessment, you gather your tools. Having everything you need right there at the bedside, all organized, means you're not scrambling for something in the middle of the procedure. You've got your tube, your lube to make it more comfortable, your syringe, and your pH tape for confirmation. You are ready to go.
Now this might be the most important piece of preparation, and it has nothing to do with equipment. It's all about communication. Let's be real, this is an uncomfortable procedure. Telling the patient they might gag isn't about scaring them. It's about preparing them. Being supportive, explaining what's happening, it builds trust and helps them work with you, not against. Okay, the patient is prepped, our supplies are ready at the bedside. Let's walk through the actual procedure, step by step, from measurement all the way to insertion.
So, phase 1 is all about getting the setup perfect. First things first, you confirm the order and you confirm your patient's identity. Then, you get them into what's called a semi-Fowler's position. That's basically a semi-upright position, which helps prevent aspiration. Now for the crucial measurement. You're going to go from the tip of the nose to the earlobe and then down to the xiphoid process. That's that little bit of cartilage at the very bottom of the breastbone. This path gives you a really good estimate of the distance to the stomach, and you mark that spot on the tube so you have a clear target.
All right, now for the insertion itself. After you pick the nostril that seems more open and you get the tube nice and lubricated, you begin. And the key here is teamwork with the patient. As that tube reaches the back of the throat, you have them sip some water and swallow. That swallow is so important because it opens up the esophagus and it closes off the airway, guiding that tube right where you want it to go. You just gently advance it with each swallow. The moment that tube reaches your mark, your focus has to shift entirely to safety. You watch their vital signs like a hawk. At the very first sign of respiratory distress, I'm talking coughing, gasping, or a drop in their oxygen levels, that tube comes out immediately. No questions, no hesitation. If everything looks good, then you can go ahead and temporarily secure it and connect it to suction if that was ordered.
So, the tube is in, but we are not done. Not by a long shot. In fact, this next part is the single most important step for patient safety. We have to confirm we're in the right place. This is $1 million question, isn't it? The one that should be running through your mind. You can't just assume it's in the right spot. You have to prove it. So, how do we get that definitive answer?
Well, there are two key methods. The absolute gold standard, the one that is 100% reliable, is an abdominal X-ray. It's the only way to get a direct visual confirmation that the tube is sitting safely in the stomach. Now, for your routine checks at the bedside, say before you give a feeding, we rely on our second method, pulling back some of the stomach contents and testing the pH.
And 4. 4 is the magic number you're looking for. Remember that. Gastric fluid is super acidic, so getting a pH of around 4 or even less is a great sign you're in the stomach. But if you get a reading of 6 or higher, you need to stop everything. That could mean the tube has moved down into the intestine, or, far more dangerously, coiled up into the airway.
Once that placement is confirmed, you document everything. And I mean everything. The date and time, the size of the tube, exactly how you verified the placement, what the stomach contents look like, their pH, and of course, how the patient handled the whole procedure. This creates a complete legal record of care.
And just remember, a successful insertion isn't the finish line. It's really just the starting line. Now the real work begins, whether that's providing nutrition, decompressing the stomach, or giving medications safely. And that leaves us with one final thought to carry forward. With that NG tube secured and working, the next critical skill is vigilant monitoring. So what signs of respiratory distress, or tube displacement, or just general discomfort will you be looking for in the hours and days to come?